If you're experiencing tension in your pelvic floor, this exercise might be right for you. I'll be demonstrating the standard Happy Baby exercise as well as a modification if you're having trouble with the exercise. I'm Dr. Huang. I'm a physical therapist here at Rehab and Revive. In conjunction with physical therapy, I also specialize in lymphatic drainage and pelvic rehabilitation. The pelvic floor is a commonly used phrase in pelvic physical therapy. It is a group of muscles that close off the pelvic outlet, acting as a hamlet-like support of the pelvis. The pelvic floor supports the abdominal organs and plays a key role in urination, bowel movement, sexual function, and postural support. Now I'm going to show you Happy Baby stretches to help kind of lengthening your pelvic floor. You're going to go ahead and lay down. And what you do is you're going to grab inside of your foot. And then you're going to open your leg out if you can. If you feel like this is already kind of feeling the stretch at the pelvic floor, then you can stay here. But you can slowly open it up. And what you do is, as you're holding in this position, you're going to go through the reverse Kegel sequence, which you can find in our previous video. I'm just going to walk you through a couple of them. So you're going to do your diaphragmatic breathing. As you're breathing through your belly, you feel your pelvic floor muscle expanding and opening. And you're going to kind of think about flower blossoming of your pelvic floor to really just try to opening and stretching. So you need to feel kind of like this motion in your pelvic floor area. We're going to hold this position for about 30 seconds just to really stretching that area. And sometimes you can do a little rocking side to side, just to help loosen things up. Really utilize that deep breathing to help you open it up your pelvic floor. And you can relax as you come back. And we'll do a second time. To bring your leg up and out. Take that deep breath and really open up your pelvic floor. Think about that flower blossoming. Feel for that opening, lengthening of your pelvic floor. And then slowly bring your leg back. Now for people who are very, very tight at the hip, what you can do is you can just bring your arms out to the side to support your thigh around the knee area. And you can just do that Happy Baby stretch in this position. When you do more of the Modify Happy Baby, you really have to utilize the breathing and the flower blossoming techniques to open up your pelvic floor. And same thing, we hold it for 30 seconds. Within this 30 seconds, you might feel like your pelvic floor muscle get pulled back up a little bit because you're breathing out. It's okay, but you're going to just really try to keep it as relaxed, as open as you can. All right. Hopefully you have given this a try and felt a change. Check with your healthcare professional to make sure this is right for you. I'm Dr. Huang, and thanks for tuning in.